now that you have the regular fibered coils packing a soft, you literally can address almost 99% of embolization needs in an individual.
You know, the microcatheter compatibility is probably my favorite aspect. The compatibility of microcatheters takes away a lot of the thought process and what coil you're going to use.
The last thing you want to do is to spend 30 minutes, 40 minutes to get to a vessel and then realize that the coil you want to use is not compatible with your microcatheter, which is a problem with many of other coils that are on the market.
When you compare the number of EMBOLD fibered coils that we might use with maybe a combination of EMBOLD fibered and packing coils, it is very clear that we are using fewer coils when treating patients using the EMBOLD system. By using fewer coils, by having the volumetric advantage of a packing coil, we are clearly using fewer coils, which has translated into shorter procedure times. I think at most centers, probably at every center across this country, there are inherent advantages to limiting the number of vendors that we work with. So while each manufacturer of coils is clearly producing a product that has some benefits in some situations, there are no doubt economic advantages to working with a single vendor, because at that point, hospitals are usually able to achieve the best price points for their product.